Hey, welcome to the Gwinnett Small Business Spotlight. We love to feature and celebrate the small businesses within our community through quick interviews. You're going to learn who they are, what they do, why they do it, why you should use them, and where you can find them. And I encourage you to seek out and support these men and women who are helping make Gwinnett County great. And today's guest is Dr. Chris Connelly, and he's telling us about Braincussion, a company he founded. He's the Chief Education Officer to assess and help treat patients that have sustained a TBI. Dr. Connelly, thanks again for being with us.
Thank you for having me.
Yeah. Now, when we left off, we were going to talk about how TBIs are currently being handled within the medical community. Tell us how they're doing it and what needs to change in the way they're doing TBI evaluations.
Well, first of all, they're just plain being missed. They just go undiagnosed for months or even years. And so I think the first thing, and this is the main purpose of Braincussion, is awareness for providers and the public that TBI is a real event that needs to be identified early on to give the patient the best possible chance to get some resolution of their symptoms and help the brain heal. We can't change the fact that there was a brain injury. What we can do is give the patient hope and all the different tools to help them so their brain can try and heal as best as possible.
One of your prior lectures that I attended on TBIs, you referred to a TBI as a by-the-way injury, where the medical professionals say you have a fractured arm, a cervical herniation. By the way, you have a TBI. Why do we need to get away from the by-the-way injury definition? And again, what else can be done?
Well, I think starting off with recognizing the symptoms, the signs and symptoms of TBI, and then talk to the patient about things that could help their brain heal and things that could make it worse. Something as simple as saying, look, you shouldn't be on a ladder. I've had patients before that had work injuries. They had a TBI. The doctor didn't recognize it, and the patient was back at work on a ladder and fell off the ladder because they had vertigo and dizziness, had a repeat brain injury. Obviously, one brain injury is bad, but when you have multiple injuries, that's not going to make it better. So I think the awareness is key to help patients get the entry-level care. There's also lifestyle medicines and different foods and things and activities to do that will help and things that will hurt. So, for instance, blood flow. The body's really designed that when you have a TBI, the blood flow to the brain reduces anywhere between 30 and 50%. So that reduced blood flow can be a problem because if they don't do anything, if they don't increase their heart rate to like light exercise to help the blood flow get back to normal, what will happen is that will reduce the blood flow to the brain and make the delayed symptoms continue to progress long term. So there's a whole litany of different things to help the patient heal. And also there's a whole grouping of things that will cause them to have more problems, like alcohol, stress, being on the phone. And so when you identify, one, the patient realizes that they really have a problem. Two, you give them the tools to say, okay, this is how we manage it. It's not something that's ever going to be cured or fixed 100%, but if we can help management and reduce the symptoms, we're in good shape.
Yeah, and before we can get to the management, the important thing is making sure the medical professional diagnoses the problem. How often is this missed in an emergency room setting? Say someone's in a car wreck and they go to the emergency room by ambulance.
Well, sadly, it's very common. In fact, one study found it was 56% of people who were later found with TBI actually had a brain injury at the ER that was missed. Another study found that, about 50% of the patients who were diagnosed at the ER, that they were failed to follow up. So 6 months later, they still had not been followed up by a doctor because they thought it was nothing. But they still had symptoms. So I think, one, that early diagnosis is important, but also make sure there's a mechanism to follow up to get adequate early care.
And testing is so important, and I know when this is done in a hospital setting, ER, or they return to the hospital because of the symptoms, if an MRI or CT scan is done, oftentimes those are within normal limits. What is the percentage of those that are normal in the reading of the scan, and why is that?
Well, sadly, it's very common. So about 95% of MRIs or CTs are going to show no significant findings because there's no bleed. And so we see that a lot of times too, where a patient says, well, they said I don't have a concussion. Well, no, they said you don't have a mild or severe brain injury because there's no bleeds, but a mild traumatic brain injury wouldn't show up on an MRI anyway. But it's important to recognize that brain injury is on a microscopic level. So the tissue damage is on such a small scale because those neurons are so small. It's on a microscopic level that there's no way to see it on the diagnostic test accurately. So it is more of a clinical diagnosis. It's something where, just like depression or mental health issues or other types of physical symptoms, you want clinical correlation with the symptoms and the history, but it's really more of a clinical diagnosis than something that's going to show on a CT scan.
All right. Well, let's talk about the testing component. We have x-rays for broken bones. We have CT scans, MRIs to help, say, diagnose a herniated disc. What kind of tests, what kind of assessments are out there to help a healthcare provider assess a TBI?
There's a couple that are FDA approved. One that we like is impact test. So impact test is probably the most reliable gold standard test throughout the United States. And Braincussion is happy to be a partner with impact testing to help promote awareness. But what happens is they have post-injury tests that they could actually gauge a patient's symptoms and help classify it. And then usually a neurologist, neuropsychologist, or a physiatrist or a neurosurgeon will help to also clinically diagnose it as well. But impact testing is used in the NFL, it's used in lots of high schools and colleges. So impact test is pretty much a gold standard. There's about 7 or 8 other ones that are FDA approved, which those are fine. I mean, they're FDA approved, but impact is the one that we prefer.
Do you do an initial assessment in your office before referring a person out for the impact testing?
We do, and it's important to screen because there are some things patients may look like they have a TBI, but they don't. So we use a couple different forms, but also the clinical observation of the patient. But you have the ACE concussion questionnaire, which is put out by the CDC and used on sidelines throughout America for concussion diagnosis. We used the Stanford concussion questionnaire, which was developed by Stanford University for college athletics and just sports injuries. And more on a scientific approach, I like the River Mead. And the River Mead is a great tool to help triage patients. So you want to identify the symptoms and pre-screen them. And then if it looks like they do have a TBI, then you refer them for the impact testing or you refer them to the neurologist or medical provider to be able to, again, confirm the diagnosis.
And I know the healthcare provider is going to do the initial assessment on the patient. But how important would it be, say, for a family member or family members to accompany the patient for that visit if they suspect a TBI?
It's very important because it's important for the family member to know what's going on too, but also to identify some of the symptoms. You know, we've had patients who they were actually losing consciousness and they thought, well, they were just tired, but they were actually losing consciousness. One in particular, they were sitting right here in the waiting room in the office and were losing consciousness. We had to send to the ER. Turned out they did have a bleed, and they actually had to do surgery to repair the bleed. But it's really important for the family, since they're going to be around most, that they could help identify more serious symptoms, but also help to know what to do at home to help take care of them.
Well, Dr. Connelly, thank you. You have enlightened us on the big problem that is a TBI, the long-term problems that a patient can expect because of it. You've also talked about the shortfalls that we have right now within the healthcare community on the proper assessment, diagnosis, and treatment of that. And in our next video, I would love to ask you more about how Braincussion is filling that void and how people can take advantage of this new company. Okay?
Okay, thank you.
Thank you.